again, on behalf of the Ohio Legislative Black Caucus, we first and foremost support the expansion of Medicaid. Not only is this good for the individuals, the 275,000 individuals within the state of Ohio that could see health insurance provided for them, but it's also about economic development and business development, because it is about $20 billion as you look at the dollars coming into the state to support health care, all of the various forms of health care and those that provide that care. One of the issues that we are very concerned about is to ensure that the Medicaid program continues to support the inclusion of pregnant women up to the 200% of the federal poverty level, and that we ensure that we have comprehensive preventative care, including family planning. We want to make sure that we target, and Dr. Sykes will talk about this a little bit later, that we target funding for an initiative that's going to focus on racial and ethnic populations in our major urban centers, because that's where the majority of people of color live, in the Cleveland and Columbus, Toledo, Youngstown, Dayton and Cincinnati areas of the state. So he will talk about that. We want to look at adopting what's known as health enterprise zone legislation, similar to that that was adopted in Maryland. We have a statewide organization that's called the Ohio Statewide Health Disparities Collaborative, and they have what's known as the Ohio Plan for Action to End Health Disparities. I won't give the detailed information, but we want to support the adoption of that plan because it goes to eliminating health disparities. We also want to make sure that we continue to work with the Office of Health Transformation, and our president spoke about working with the administration. We plan, and we will have a meeting with Director Moody this afternoon. So we're going to work with the Office of Health Transformation, the departments, the Health and Human Services departments in the state of Ohio, and the Ohio Commission on Minority Health, which is our lead agency on racial, ethnic disparities conditions in the state, to work with them on the development of a tool that collects data and identifies disparities within racial and ethnic populations. The administration is working on a survey monkey that's going to elicit that kind of information from each of the Health and Human Services departments, so we see where the gaps are and what kinds of mechanisms, strategies, tools, and funding need to be put in place to eliminate those disparities. We want to ensure that all data collection, we are putting contracts in place now, and it takes Director Dawson of the Ohio Commission on Minority Health to really talk about this. We are developing contracts right now for the health data software and systems to collect data in our Health and Human Services departments, such as our CRISI system, and we want to make sure all of those systems are compliant with the federal Health and Human Services standards around class, cultural and linguistic appropriate standards, so that we're collecting data on race, ethnicity, language, so that we know where the trends are, we know where the absolute disparities are, and then we can put those tools in place to eliminate those disparities. And then finally, we want to implement the Ohio Disparities Reduction Initiative within the Ohio Commission on Minority Health. And I'm going to turn this now over to Representative Sykes.